Hi, I'm Dr. Ben Beach, a dentist here at Shreveport Bossier Family Dental Care, and today we're down here at our South Bossier office, which is on Barksdale Drive, about a mile south of the base of Bossier Air Force Base. And I just kind of want to introduce everybody to one of our newer facilities here. Meet some of the staff and kind of get a good feeling of what the office looks like and what you can expect when you come in. So come on, let's meet some of the girls. Lauren, how you doing? Doing all right? We're just kind of showing everybody the South Bossier office, making a little video. This is Lauren. She's our front desk girl that checks people in at this office. Lauren, I know you're in charge of getting all the paperwork done, collecting insurance information, driver's license information. For a new patient coming in, I know there's a lot of paperwork sometimes we got to get filled out legally. Don't you like our patients to get here a little bit early to fill that paperwork out?
Yes, definitely. We ask you guys to come in 20 minutes early just to make sure we have enough time to get it in. If you have any questions, we're able to answer them, and then that way we can get you back on time. When you show up a little bit late, it's hard for us to get everything we need up here at check-in.
Yeah, so 15, 20 minutes early.
Yes, 20
and
preferably.
20 preferably,
yes,
huh?
Yes.
And you need, correct me if I'm wrong, what, driver's license, an updated insurance card.
Yes.
Can you
Driver's
elaborate?
license, insurance card, and at the end of the day, we just do payment ahead of time. So if you're not going to be the one paying, we would need your mother or whoever is going to be doing your payments here with you, preferably, so they can sign the receipt.
I know the kids' office is next door, but we still see quite a few, older kids here.
Well, still 19, sometimes still mama helps out.
Sure, I understand that. Well, great. So you'll be seeing Lauren as you come and check in, and she does great. Any questions you might have, she's kind of the go-to girl with all that kind of information. And, well, thanks for your time. Let's go meet some more of the staff. So, thanks.
Thank you.
All right, we're in kind of the back area here, and before we actually get to the clinical area, we're gonna slip in the consult room and talk to Crystal. She's our head financial coordinator at this office, and let's see what she has to say. Crystal, what's going on, girl? How are you doing?
Good. How are you?
Good. Crystal's one of our tenured girls who's been here, 3-4 years, so she's been around a while. She's also one of our team leaders for the administrative area, and she does a great job for us. She's seen and done a lot of things, in the office administratively. So she's dealt with insurance companies and billing and insurance questions people have, And in this consult room, I know you deal more with the more comprehensive, the more in-depth treatment plans. Some of those can get a little bit more expensive. Can you talk to us a little bit about the financial arrangements you can make with our patients if they need to take advantage of any?
Yes, definitely. We actually offer Care Credit. It's a third-party financing company that we accept, and you basically use it like a credit card. You would come in and we could offer you 12 months no interest. If you wanted to extend out those payments for about 48 months, we would charge interest, but that varies depending on how much your treatment costs.
Sure, right.
We also have a membership club that we offer, and it's kind of like a discount plan. You would pay $89 fee, then $34 a month.
Right. A lot of people that don't have insurance are taking advantage of the membership club. That seems to be, a very, very formidable approach to help pay for dental care that they need. We got a lot of people that have joined that program and really like it, and there's still a lot of employers out there that don't offer dental insurance, so it's just kind of like that. And to do the math on it, you come in and have your cleaning done, it's paid for itself. So essentially, you've got a 25% discount on all your treatment outside of that. So I know a lot of people are taking advantage of that. Crystal, you've worked with a lot of offices. You've kind of been out in many other workplaces. Y'all seem to work very well as a team here. Y'all got great staff, and I'm always raving about how great a staff we have, but it's true. And I'm certainly not responsible for pulling these girls together. How do y'all do it over here? How do y'all take care of each other and our patients like you do?
Well, I think over here we're just like a big family, and that's what I love about this practice at any of the offices I've been to. It's just like a big family, and we have the best girls for each position. Y'all met Lauren. She's super bubbly and great. Whenever you come in, and she makes you feel really welcome. We just have a great staff, and we all work well together, and actually, you know, enjoy coming to work.
Sure.
So, and that just makes the atmosphere and everything so great.
Our
It's wonderful for
sense
patients.
that too, right?
Yes.
So, well,
Yes,
good,
it can.
good. Once again, this is Crystal. So if you come to our South Bossier office on Barksdale, you'll see a lot of Crystal. She'll be around. Any questions or problems you might have about, you know, insurance or billing or any of that kind of stuff, she takes care of all that. So, well, thanks for your time. We're going to go meet some more of the staff in the back here.
All right.
All right, thanks. Now, of course, we're getting in the clinical area here. You see all the operatories here, but I'm going to take you in a hygiene operatory now, and this is where as a new patient comes in for cleaning, they'll, you know, this is where they'll be being treated. So let's come on in. Let's meet one of the hygienists. Hey, Jamie, how are you doing?
Good.
This is Jamie. She's one of our hygienists here at the South Bossier office. Now here at South Bossier office, well, we have 4 hygienists here.
Yes.
And we have 2 doctors here pretty much every day of the week.
Yes.
And Jamie, can you tell our prospective new patients what to expect as they come in for, you know, for a cleaning, exam, and all that kind of stuff on their first visit? Yeah.
Sure. We like to get you in, come back, and we get you comfortable, get you a blanket, whatever we need to do to get you comfortable. We go over. We like to sit and talk and kind of get to know the patient, what they're here for, kind of go over medical history, and this is a really comprehensive look at everything. So we take X-rays. There's plenty of X-rays we take on the first visit, but we like to, you know, see everything and kind of get a plan going and try to ease the patient's fears and any of their, you know, embarrassments or anything they might have. We'd like to minimize those things and just kind of keep them comfortable and kind of get a game plan going.
Sure, get a game plan. Doctor will come in, you know, as you're clean or maybe after clean. Dr. Haydell or Dr. Wayne will come in and, you know, do examination and all that kind of stuff. You know, I know you talked a little bit about comprehensive treatment. I know you and I are on the same page with this, that, you know, it's more than just about the mouth. We're treating the comprehensive whole body, and then we're real big on taking medical history and taking blood pressure, and, you know, if it's a diabetic patient, we'll take blood sugar sometimes.
About the A1C.
That's right. That's exactly right. And Jamie does a great job explain. You know, even if we do find a filling or maybe a crack in the tooth, we do a good job of taking pictures of that and putting it up on the screen so, you know, the patient can actually see where the problem is and what's going on. You know, you've been in dentistry, what, 24, 25 years? Yeah, you've been with us 4 or 5 years.
Yes.
You know, you moved here from Dallas.
Yes.
So you've kind of been exposed to a lot of different offices in your tenure in dentistry, in your career. You know, what sets our office apart from other doctor or dentist offices you've worked with?
Well, I mean, like you said, I've been in dentistry a long time. I've seen I've worked for a lot of really great practices, but this is really the most organized teamwork effort here, and that we just, you know, really look at the patient. We help each other. We treat each other like a family. We treat the patients like a family. And all that teamwork and the organization that goes into everything just helps us to focus on the patient and, you know, find out what they want and help take care of them.
That's right. You made a great point there, and I think one of the other offices we talked about, you know, we're going to tell the patient what they need. You know, legally we're obligated to give them a comprehensive treatment plan of everything we see, but at the end of the day, we're going to do what the patient wants to do.
Exactly.
And if they've got a little chip on the front tooth and that's all they want fixed, we're going to take care of that for them. We're not here to push a bunch of treatment on you, but, you know, once again, we're legally obligated to tell you what we see and what we're trained to be looking for and what we're trained to fix. But we're going to do ultimately what the patient wants to do. And these hygienists are on the front line of that, and they do a great job. I can't rave enough about how awesome they are over here. We've got great hygienists, we've got great front staff, we've got great doctors. Y'all work very well as a team, and I'm always impressed when I come over here. And, you know, y'all do such a good job, and you know, we appreciate, of course, all your hard work, and you know, and I know as a staff we're very collaborative, and you know, the hygienists will help front staff, and you know, front staff will, you know, help where they can, and y'all help the clinical staff, you know, the doctors and their assistants, and we work, like you said, we work well together as a team, and and that allows everybody to have better focus on the patient they have in front of them. And y'all do a great job of that, and I'm always impressed when I come here. So, man, y'all keep it up. Y'all are doing a great job. So, all right, thanks for your time.
All right, thank you.
Let's go meet some other staff. All right, let's check out one of the clinical rooms. Hey, Drew, how are you doing?
Hey,
doing
good.
all right? Yeah. Drew, today we're just kind of telling any prospective new patients, tell them about the South Bossier office and how good of a thing y'all have going on down here. Drew's been an assistant at our office, what, 6-7 years now? Yeah, for a while now. And she's actually sisters with Cassie, one of our Bossier assistants that heads up the clinical area over there. And anyways, Drew does a great job for us. And you know, let's talk more about this practice. I know it's one of our newest facilities.
It is.
It's beautiful here. Y'all did a great job decorating, and it seems like the staff is such just a positive aura about them. But you know, and that seems to make patients very comfortable.
It does. It makes them calm, knowing that you care, and that you're here for them, for their comfort and their needs.
Yeah, right. I know what you offer: blankets and headphones, and we got little pillows, and of course TVs to watch. You know, anything we make, any way we can make the patient experience more positive, you know, we try to do it.
Right.
Along those same lines, I know we have a lot of nervous patients.
We do.
And for those patients, I know we offer some sedation techniques. Can you talk a little bit more about that?
Yeah, we have one sedation where you can drive yourself to the office, and you can drive yourself home. No one has to stay with you. It's nitrous. It's a little bit of laughing gas. It might make you feel a little tingly inside. It just makes you relax for the procedure. We have a couple other options. One is oral sedation, where you take a medication before you come into the office. Now, someone has to drive you, stay with you throughout your entire appointment, and stay at home with you, and you know, keep a close eye on you. But that's the oral sedation. And then we have one where a nurse anesthetist actually comes into the office and IV sedates you for your appointment. You'll be asleep, relax, and you probably won't remember anything for that whole appointment, really.
And that's for the patient who's just really, really scared. And we do have those patients. Maybe were traumatized when they were kids.
As a child, absolutely.
And, you know, as an adult, they're scared to death to come to the dentist.
Yeah.
We've got patients who they're scared to even walk in the front door. I mean, for those patients, they need a little bit deeper sedation. That's where the IV sedation comes into play. And we've had a lot of people, you know, really come to us just for that reason alone, because we offer that.
There's not many that do that.
That's right. You know, so we're doing all we can to make sure our patients are comfortable and being taken care of. I know our staff, we really work well together, and at times we even come together and do a lot of charity work. I know coming up we're fixing to do a little charity event for breast cancer awareness. One of our hygienists, one of our other offices, just got diagnosed with breast cancer, and so through her we're sending our support to as much breast cancer. So if you come on a Wednesday during the months of September, October, you'll see everybody wearing pink, and you know, from you know, on her behalf, and so we're always doing things. And I know we've got, you know, every spring we have the Trading Smiles.
Trading Smiles, that's right. Where anyone close to the community, you know, as far as Texarkana even, they can come in and get free dentistry, you know, a cleaning, an extraction, or a filling. They can just come in. We like to give back multiple ways. So you bring in some canned goods and we'll donate those out. And that's just another way that we can help out, and we help take care of you in the process. And
that's that Trading Smiles Day is usually done in our South Shreveport office. But
yes, that's
all
our
the girls,
office.
Drew, myself, the rest of us, we really, you know, we volunteer our time. Nobody's getting paid for this. Just out of the kindness of our heart. We do all this free dentistry for people, and we have people lined up at 2 or 3 in the morning, the night before. And
they come and camp out.
They come from Dallas, from Texarkana, like you said. I had a couple from Jackson, Mississippi last year that came in, and you know, it's just another way we can give back our talents to the community and help those that need our help. So, you know, that's the kind of people we have working with us, people that care about other people, and you know, and we're here to make sure our patients are being taken care of to the best of our ability. And because of girls like you and Cassie and the rest of the crew, is how we've become such a successful enterprise is because we have staff like you who really care about patients, and that's a big deal to us. Well, Drew, thanks for your time. Well, we appreciate it. So y'all come see Drew here at the South Bossier office. I know some days you're at South Shreveport office with Dr. Dees, but so she's kind of our floater. You'll see her everywhere, but she's a great girl. We're glad we have her, and so thanks for your time. Appreciate it. All right. And here at the South Bossier office, we have Dr. Wynn, who just started with us not too long ago, but she's from New Orleans area, and she's been practicing for a while after school. Doc, you're doing what, root canals and of course fillings, extraction, root, crown and bridge work. You also did a residency in implant restoration, right?
I did an implant fellowship for a year.
Implant fellowship, so she's kind of our implant guru around here, and she's doing a great job so far, and we love having her on board. And Doc, since I know you've worked at other practices before, and you're kind of new to our practice. How's the staff treating you so far? How do you like being with them and working with them?
The staff is wonderful here. They're so helpful, so resourceful. They're very reliable.
Yeah, right. And I know we kind of do everything we can do to make our patients feel comfortable. And,
for sure.
And that's one thing our doctors kind of play into too. Dentistry isn't easy, and sometimes we go overboard to try to either through sedation or giving our patients blankets or pillows or headphones. We do everything we can to make sure our patients are comfortable, right?
Yeah, most definitely.
And Doc, you're here what, Monday and then Wednesday, Thursday, Friday? Yeah. Yes. And then she works some Saturdays with us at the South Shreveport office, because that's the only office that's open on Saturdays. But Doc, say we have a patient that has an emergency, needs to get in pretty quick. Is it this South Bossier office, does it seem to be pretty easy to get in as an emergency exam?
Oh yeah, for sure.
Yeah.
Just give us a call and we'll get you in as soon as you can.
As soon as we can, and usually the same day, and a lot of times we can even hopefully do treatment that day. If time allows, and it's something that we feel like we can squeeze in the schedule, we'll go ahead and try to treat you that day that the occurrence happens. But
so just give us a call and we get you in.
Sure. Well, come see Dr. Wynn. We'd love to see you. She's a great doctor. We're glad to have her on board with us, and so we'll see you soon.
All right, thank you.
We're here right now with Dr. Haydale. He's one of our other doctors here in South Bossier, and Doc, you've been with us 3 or 4 years, and you're pretty much doing everything, right? You're doing root canals, extractions, restoring implants, fixing to start placing implants, jack of all trades. We get a lot of really good reviews on Dr. Haydale, and of course this office as a whole, but I know I'm always kind of bragging about the staff and how good of a job they do for us. Can you talk more about the staff you have here working for you?
Yes, I'm over at the South Bossier Barksdale Boulevard location, and we just opened up this office about 1.5 years ago, and things are going really well. We have a really well-trained staff here, all the way from the front desk to the back. Our front desk ladies are real welcome and trained well for greeting the patients, and checking the patients out, and we have great hygienists. We have 4 hygienists on staff here, and 2 doctors, at a time. So we're really here for our patients 5 days a week, and we're ready to take care of all their needs and make our patients feel real comfortable here in South Bossier.
Like I was saying in one of our other videos, that's one thing I like about a group practice is that if another doctor's out, well, you got one here. There's always somebody going to be here. There won't be a time where we're just not open. And of course, at this office, Saturday or Sunday we're not open, but Monday through Friday, somebody's going to be here to see you, whether they have an emergency or you need a crown done or a filling done. We're here to serve that patient base. And
that's the benefit for our group practice. We're here for the patients, 5 days a week, 7 to 5, and if somebody has an issue with something, they can come right in, and with us having 2 doctors and 4 hygienists, we can usually accommodate our patients and get them in, pretty quick, to take care of whatever needs they have.
Yeah, and I know you're real big on making your patients feel comfortable, and whatever that takes, either through sedation or even a blanket or headphones or on those lines. Man, y'all do a great job over here. Like I said, we get a lot of rave reviews on this practice, and as far as emergencies goes, y'all pretty much can see emergencies at any time, right?
Yeah,
we can squeeze people in.
Yeah, we're ready to see emergencies same day. So, you know, if you have a problem with anything, just give us a call and we'll try to get you in, you know, the same day and take care of whatever issues we can. If we can't take care of it that day, we'll at least, you know, get you comfortable.
Yeah,
where
get
we
you out
can,
of pain.
get you back and take care of the treatment relatively quick.
Right. Man, y'all are doing a great job. You know, keep it up. You've got a great staff over here. You know, like I said, your hygienists are awesome. Your front desk is awesome. You know, your clinical staff, your assistants helping you out are really good. Man, y'all keep it up. We're getting a lot of good reviews on Facebook and Yelp and you know, on Google reviews and all that kind of stuff. So, you know, that tells the tale. Something's going right. So, y'all come out and see Dr. Haydell and Dr. Wynn, and even Dr. Patton is over here a couple days a week. So, we've got the doctors here to see you, and we love to have you. We're always accepting new patients. So,
yeah.
Great.
Thanks.
All right, thanks. See you later.